Hi, my name is Bertrand Dirk, and today we'll be discussing about cyclical vomiting syndrome. Now, cyclical vomiting syndrome is categorized as a migraine disorder. The main presentation of cyclical vomiting syndrome is episodes of severe vomiting followed by complete symptom-free periods, hence the cyclical nature of the disorder. However, occasionally sufferers may experience mild symptoms in between. Now, the episodes can last anywhere from 1 hour up to 10 days. Within each episode, the sufferer will vomit at least 4 times per hour, and an attack can last 1 hour or up to 10 days, which can often lead to severe dehydration. Now, notably, the episodes present similarly in terms of duration, time of onset, intensity, and type of symptoms as well. Now, it is also more common in children, with children ages between 3 to 7, which are most affected. In some cases, it can also occur in adults as well. Let's discuss more about the symptoms. Now, unfortunately, cyclical vomiting syndrome is often difficult to diagnose, as the symptoms can present very similarly to other disorders. Now, the common signs and symptoms include recurrent episodes of vomiting that can last up to a week, with severe nausea and intense sweating. Accompanying features that may or may not be present also include abdominal pain, diarrhea, fever, and even dizziness. Now, whilst this condition is considered to be a migraine disorder, it is actually very rare that it is associated with headaches. This is due to attacks including headaches being classified as classic or common migraine. Now, what is the difference between abdominal migraine and cyclical vomiting syndrome? Now, though they are often mistaken for the same condition, there are differences between abdominal migraine and cyclical vomiting syndrome. Now, cyclic vomiting syndrome refers to waves of intense nausea, vomiting, and other stomach problems for no obvious reason. It may also last up to 10 days compared to abdominal migraine lasting around 3 days. Now, while you may experience nausea and vomiting as a symptom of abdominal migraine is often experienced purely as abdominal pain. In both cases, sufferers can experience loss of appetite and pale skin during an attack. So, then what is the cause of cyclical vomiting syndrome? Now, the current exact cause of this condition is not 100% known. However, some theories suggest that certain chemicals produced by the body, for example histamine and serotonin, have a role to play. Other possible causes include genetic differences or hormonal imbalances. Cyclical vomiting syndrome can be hard to diagnose, as children may have difficulty distinguishing between stomach flu and abdominal migraine. Other causes of stomach pain should be ruled out, such as irritable bowel syndrome, gastroenteritis, and even things such as appendicitis. In children affected with cyclical vomiting syndrome, it is more likely that they will experience migraines or headaches when they reach adulthood. In those individuals that may be suffering from cyclical vomiting syndrome and have no underlying pathology or disorders that can be recognized, another known cause may be due to a sensitized brainstem. Now, sensitized brainstem has a lot of cranial nerves inside there, which can then be perceived as non-threatening stimuli, such as eating certain types of foods, which can then cause cyclical vomiting syndrome symptoms. Now, if you believe that you may suffer from cyclical vomiting syndrome or abdominal migraines, then we recommend that you do seek your general practitioner, or even, more importantly, a headache clinician. Now remember, cyclical vomiting syndrome is a migraine disorder. So a headache clinician can hopefully rule out and diagnose whether you do suffer from cyclical vomiting syndrome. Once a diagnosis can be confirmed, safe treatment options can be commenced in order to help the cyclical vomiting syndrome. My name is Bertrand Dirk, and I hope you've enjoyed this presentation and have a better understanding of cyclical vomiting syndrome. Thank you.